Welcome, and thank you so much for your participation. My first name is Mark Jason, and I'm a third year Doctor of Nursing practice student at Seattle University's College of Nursing. I'm excited to present this training module for college peer health educators. My focus is on preventing the misuse and diversion of prescription stimulants on campus. As peer health educators, you have a unique role in fostering awareness, supporting peers, and promoting safe practices. Let's begin with our objectives for today's session. By the end of this training, you will: 1. Understand the nature and risks of prescription stimulant misuse and diversion. 2. Recognize patterns and risk factors associated with misuse among college students. And 3. Learn evidence-based strategies for prevention, harm reduction, and effective intervention. This training will equip you with the knowledge and tools to be effective peer health educators in addressing these issues. Let's take a closer look at prescription stimulants, focusing specifically on Adderall, one of the most commonly prescribed medications in this category and commonly misused among college students. So Adderall is a central nervous stimulant that contains two active ingredients, dextroamphetamine and amphetamine. These compounds work together to stimulate brain activity, which can help improve focus, alertness, and self-control. Adderall is approved to treat two primary conditions. First, it is used for ADHD to help individuals manage symptoms like inattention, impulsivity, and hyperactivity. Second, it is prescribed for narcolepsy, a sleep disorder, to help individuals stay awake and alert during the day. Adderall works by increasing the levels of two key neurotransmitters in the brain, dopamine and norepinephrine. Dopamine plays a role in motivation and reward, while norepinephrine affects alertness and focus. By boosting these chemicals, Adderall helps regulate the brain's ability to concentrate and process information more effectively. Like any medication, Adderall comes with potential adverse effects, such as cardiovascular issues like increased heart rate and high blood pressure are common. It can also cause psychiatric or behavioral effects, including anxiety, irritability, mood swings, or even paranoia in some cases. These risks are especially pronounced with misuse or higher doses. Because Adderall is a Schedule II controlled substance, it has a high potential for misuse and addiction. Misusing it, whether by taking it without a prescription, in higher doses than prescribed, or for non-medical purposes like studying, can lead to serious consequences. Additionally, misuse can result in legal and academic outcomes, as taking or sharing prescription medication without proper authorization is both illegal and a violation of most campus policies. Let's dive into the epidemiology of prescription stimulant misuse, particularly among college students, to understand better the scope of the issue and the factors that contribute to it. Prescription stimulant misuse on college campuses continues to be on the rise, raising significant concerns for college students. Research shows that 11.1% of college students have misused stimulants such as Adderall during their academic careers, while only 8.1% of non-college attending peers reported similar misuse. The prevalence tends to spike during high-pressure periods such as midterms or finals when students are feeling the strain of educational expectations. It's important to note that misuse occurs across all majors, but it's especially common in competitive academic programs like pre-med, engineering, and business. So why do students misuse prescription stimulants? The motivations typically fall into two categories: academic performance and stress management. Many students perceive stimulants as a way to enhance focus, energy, and productivity, especially during long study sessions or when facing tight deadlines. However, studies show that these benefits are often overestimated, especially for those without ADHD. Some students misuse stimulants to cope with the stress of balancing academics, extracurriculars, and sometimes part-time jobs. They may view stimulants as a quick fix to maintain their energy levels or manage their workloads. Beyond individual motivations, there are environmental and social factors that fuel this behavior. On many campuses, stimulant misuse has become normalized. It's often seen as an acceptable way to handle academic pressures with phrases like study drugs, making misuse seem less severe. Peer influence also plays a big role. If students see their friends or classmates misusing stimulants and performing well academically, they might feel the pressure to do the same, believing they'll fall behind otherwise. Recognizing patterns of prescription stimulant misuse is essential for early intervention and supporting peers effectively. Let's explore two key areas: behavioral indicators and risk factors. Behavioral indicators may signal stimulant misuse. One red flag is students borrowing or asking for medication from peers, even casually. This is often framed as just needing help to get through the exams, but it's a clear warning sign. Another indicator is secrecy, such as avoiding direct questions about how they are managing stress or academics or hiding their use of medications. Finally, erratic behavior can be a sign of misuse. This might include drastic mood swings, unexplained bursts of energy, or crashes where they seem unusually tired or withdrawn. These behaviors are often more noticeable during high stress periods like finals or midterms. Now let's move to the risk factors that make students more susceptible to stimulant misuse. One major factor is being in a high pressure academic environment where competition and expectations can drive students to look for an edge. This is especially common in fields like pre-med, engineering, or business where the workload is particularly intense. Another critical risk factor is mental health challenges, such as anxiety, depression, or chronic stress. Students may misuse stimulants to self-medicate, thinking it will help them manage these struggles. Recognizing these risks is important for identifying who might need extra support. By paying attention to these behavioral indicators and understanding the underlying risk factors, you'll be better equipped to recognize patterns of misuse among your peers. If you notice these signs, consider starting a non judgmental conversation or connecting them to resources like counseling services. Early intervention can make a significant difference. Prevention is one of the most powerful tools we have in addressing prescription stimulant misuse. Let's explore three educational strategies that can help spread awareness and reduce misuse on campus. First, tailor your messaging to your specific audience. College students come from diverse backgrounds with different experiences and levels of understanding about stimulant misuse. For example, first-year students may need basic information about what prescription stimulants are and why misuse is harmful. On the other hand, upperclassmen may respond better to messages emphasizing long-term consequences, like addiction or academic integrity violations. The more your message resonates with their current experiences, the more likely they will engage with it. Providing factual information to dispel common myths is critical. One widespread misconception is that stimulants like Adderall are safe because healthcare providers prescribe them. Another is the belief that these drugs will automatically improve academic performance, even for students without ADHD. Peer health educators should focus on sharing evidence-based facts such as the risks of addiction, the adverse health effects of misuse, and conveying that stimulants don't improve grades for non-ADHD users. Correcting these myths is key to shifting attitudes and behaviors. Lastly, collaborate with student organizations to amplify your message. Partnering with groups like student government, residence life, or academic clubs can help reach a broader audience. For instance, hosting co-sponsored events or workshops during high-stress times like midterms or finals can provide students with stress and time management tools. These collaborations expand your reach and help normalize conversations about mental health and substance use prevention. Let's discuss key skills for effective peer education, essential for creating meaningful connections and delivering impactful messages. Active listening is one of the most important skills for building trust. As a peer health educator, your role isn't just to provide information, but also to create a safe space where others feel heard and understood. This means giving your full attention, maintaining eye contact, and using affirming body language. Paraphrase or ask follow-up questions to show that you're engaged. When students feel truly listened to, they're more likely to open up and trust the guidance you provide. Focus on non-judgmental communication. It's natural for students to feel defensive when discussing topics like stimulant misuse, especially if they're struggling themselves. To avoid this, use neutral, empathetic language instead of saying, you shouldn't do that. Try, let's talk about the risks and how to approach this differently. By avoiding judgment, you create a supportive environment where students feel safe discussing their concerns without fear of being criticized. Be prepared to share resources that can help students address their challenges, whether it's academic stress, mental health concerns, or substance use. Knowing about campus services is key. You don't need to have all the answers, but you should know where to direct students for professional help. Having this information readily available can make a significant difference in someone's ability to get the support that they need. Now let's talk about harm reduction approaches for addressing prescription stimulant misuse. So harm reduction focuses on minimizing risks and promoting safer behaviors even when misuse is occurring. It's critical to encourage safe storage and proper disposal of medications. Many cases of stimulant misuse start with medications being taken from someone else. Educate peers about securely storing their medications in a safe place, such as a lockbox, to prevent unauthorized access. Proper disposal is also essential. Unused medications should be taken to designated drug take-back locations to prevent them from being diverted or misused. Promoting alternatives to stimulant misuse is imperative. Academic pressure is one of the biggest drivers of misuse, so offering resources like time management workshops or stress management training can provide healthier ways to cope. These workshops can teach practical skills such as prioritizing tasks, creating realistic study schedules, and managing stress effectively. When students feel more in control of their academic responsibilities, they're less likely to turn to stimulants. Lastly, supporting peers who are already misusing stimulants to minimize risks. This entails creating a non-judgmental environment where students feel comfortable seeking help. Encourage them to talk to campus health professionals or counseling services for guidance. Harm reduction can also include educating peers about the dangers of high doses or combining stimulants with other substances like alcohol, which can be life-threatening. Policy and advocacy are critical components in addressing prescription stimulant misuse on campus. According to Seattle University's Substance Abuse Policies and Prevention Handbook, the manufacture, sale, possession, distribution, dispensing, or use by a student of a controlled or illegal substance not medically authorized is strictly prohibited. Students violating these policies may face disciplinary sanctions up to and including dismissal, as described in the Code of Student Conduct. In addition, the university may also refer unlawful incidents to local, state, or federal authorities. Understanding campus policies is essential in educating your peers and promoting compliance. Advocacy for mental health and academic support services is key. Many students misuse stimulants due to academic stress or mental health challenges. Seattle University's Student Health Center offers mental health services for students, while the Learning Assistance programs provide tutoring support. Encouraging your peers to access available resources can reduce reliance on stimulants. Finally, fostering a culture of accountability and peer support can create a healthier campus environment. By setting positive examples, providing education, and supporting your peers, you can help shift norms away from misuse and toward healthier coping strategies. To wrap up, let's recap the key points. We've explored strategies for prevention, recognition, and intervention when it comes to prescription stimulant misuse. As peer educators, you are uniquely positioned to address this issue by promoting awareness, encouraging healthier alternatives, and fostering a culture of support. Now, here's the call to action. Take what you've learned today and put it into practice. Educate your peers about the risks of misuse, support those struggling, and advocate for safe and responsible practices on campus. Every conversation you have can make a difference. And finally, remember that help is always available. If you or someone you know needs additional support, contact campus health services or counseling resources. Together, we can create a healthier, safer community for everyone.